Welcome to the Leading Movement Health Series. I'm your host, Phil Wagner, founder and CEO of Sparta Science. And today I'm very excited. We have Congressman Seth Moulton, who represents the 6th Congressional District in Massachusetts. Congressman Moulton serves on 3 committees, including the House Armed Services Committee, and has been a very successful advocate for veteran health. After he graduated from Harvard, he joined the Marine Corps a few months before 9/11 and proudly served 4 tours in Iraq. And despite being a critic of the Iraq War, he shared many of the service members' viewpoints in that he didn't want anyone else to go in his place. And so leadership is so much about leading by example, and especially when it comes to service. It'd be hard to find a more experienced leader that has both the tactical, the political, and the economic experience as Congressman Moulton. So we're excited to have him today. Thank you for joining us, Congressman Moulton.
Oh, it's an honor to be here, and please call me Seth.
Thank you, Seth. So, I know you've been such a strong proponent about health, especially around veterans. And so why is health so important to, the veteran community and really to the U.S. as a whole?
Well, it's a good question. I mean, there's a few principles that I have. One is that our veterans deserve the best healthcare in the world. Like, just absolutely no excuses for not getting the best healthcare in the world. And we know from all the stories that we hear that a lot of veterans aren't getting it. I made a commitment when I was elected to continue being a patient of the VA myself. I was already going to the VA, and I said, look, when I get elected, I'm not going to just get the congressional health care plan. I'm going to continue going to the VA. And for a long time, I was the only member of Congress who did so. And it's continued to give me a real live view of the care that our veterans are getting. I happen to go to a great VA hospital, and much of my healthcare has been exceptional. But shortly after I was elected, I was coming down here to get sworn in, and I had to have a minor surgery at a VA hospital that's not doing as well. And I won't tell the whole story right now, but I'll tell you, it was potentially life-threatening, some of the things that they did. And I realized that this is what many veterans face when they're just trying to get care. So we're not where we should be with veterans healthcare. The second thing I'll say is that, and this is not just about veterans, but about our active duty service members, we need to have a really healthy force, because it's just an unforced error, an unnecessary handicap if we don't have the healthiest force in the world. I always thought it was crazy. I mean, veterans will relate to this from the last couple of wars, how, they'd have these fancy chow halls in Iraq and Afghanistan. They did a remarkable job of bringing in American food for the troops. And it was like the most unhealthy food you can imagine. It was pizza and cheeseburgers and hot dogs. And I mean, if there's a group of Americans that should be getting the most healthy, performance-oriented meals, it's like Olympic athletes and our troops, right? But that wasn't happening. So we're just not thinking about the consequences of poor health and poor health care. And it's especially acute for our veterans and our active duty troops.
Yeah, and I know you've been such a proponent around the mental health part. And what's interesting, right, is a lot of the performance, lack of performance leads to injuries potentially, which leads to pain, right, which therefore then leads to mental health, right? So there's a cascading effect, to these veterans, I think, when the proper health isn't provided upstream, even as so far as upstream as active duty.
Well, I just talked about how we're behind on traditional healthcare, or just simply making sure that you're living healthfully and eating healthfully, right? But we're even further behind when it comes to mental health care, because we continue to think of mental health care just as a negative, a disease, like something you have to treat if it's wrong, as opposed to thinking about it proactively, right? But we don't just say to our troops, okay, if you have a broken ankle, we're going to take care of you. We actually spend a lot of time doing proactive healthcare, like physical training, to get you in peak shape. I mean, that's, of course, ironically why it's so silly that we then feed you hot dogs.
Right.
I mean, I love hot dogs. Okay? I'm not against hot dogs.
Right.
But seriously, like, that's a performance meal, okay? But when we think about mental health care, we really just think about it in terms of treating injuries or dealing with crisis, rather than recognizing that if we proactively improved the mental health care the mental health, the resilience, the mindfulness of our troops, they would be in better shape to perform even more effectively at their jobs.
Yeah, and I know, part of that is some of the policies that you've championed, like the National Suicide Hotline, right? Bringing that to the 988, and that must have been an incredible kind of bipartisan challenge, right? Because it makes total intuitive sense taking care of our veterans, but actually getting both sides of the aisle to actually agree on something doesn't seem like it was an easy process. And that's, I think, where leadership comes in. If you don't mind, talk a little bit about how you get, two sides to agree on something that would actually seem pretty obvious, to prioritize.
Yeah, so a lot of people ask this question. They're like, wow, this is amazing. We now have a 3-digit mental health hotline for the entire nation, not just for our troops and our veterans, but for everybody. And it's important people know this. 988 is out there for everybody. No matter what phone you pick up, you can dial 988 in America if your loved one is having a mental health crisis. It's saved countless lives already. And I co-authored this bill with a veteran across the aisle. But people say, okay, this is great, Seth, but why didn't we do this 20 years ago? In other words, this is so obvious, it must have been really easy to pass, and you would not believe how difficult it was to get this passed. There were debates over funding because Republicans didn't want to fund the service. There were debates over whether it should be managed by the states or the federal government. A lot of Democrats wanted it managed at the federal level, while Republicans wanted it managed state by state. And these are just a couple of the debates that we had to work through. There was huge opposition to the number we chose, to 988 itself, as opposed to some other 3-digit number, because some people wanted a different number, even though we did a federal study to pick 988 as the best option. So, I mean, it's almost comical how difficult it was to get passed. The sad part, of course, is that every day that went by that this line didn't exist, more people were dying by suicide. So it's a huge step in the right direction, but I've talked about even more that we can do in mental health care. And the next thing I want to do is really normalize mental health care the way physical health care is normalized, right? Because, Phil, if I told you, hey, tomorrow I'm going to go get my annual physical, you wouldn't bat an eye. You wouldn't say, oh, you're getting your physical. Oh my gosh, Seth, is everything okay? Are you all right? Are you sick? No, because you just go and get a physical, right? That's part of proactively taking care of your physical health. Well, we need to get there with mental health care, because my guess is that if I said tomorrow I've got a mental health care appointment, that would not be your reaction. You'd probably be thinking, you might not say it, but you'd probably be thinking, geez, I wonder what's wrong.
Right.
We need to get to the point in America where mental health care is as routine as physical health care, where it's totally normal to get a mental health care checkup. Everyone does it. Where it's totally normal to proactively take care of your mental health the same way that you might go get your physical and the doctor says, oh, you're fine, but you probably should lose a little weight, or you should probably exercise some more, or maybe you're not getting enough sleep. Right? We should have that same conversation about how to improve and strengthen your mental health long before you ever have a crisis. So we've got a long way to go in America, but we're taking huge steps in the right direction.
Yeah, I love that term, normalizing it. Is there any tactics you found with that hotline, to bring both of those parties together? I mean, you talked about even just nuances of not agreeing on the number, the 3 digits that are used. Are there any tactics for other leaders that are in healthcare or even DOD to learn from, of like, you've got two opposing groups around a really, what seemingly is an obvious priority? How do you bring those groups together?
Yeah, I mean, look, this is tough, but a few lessons that maybe could be helpful. First of all, you got to find a reliable partner. And I found Chris Stewart across the aisle, Republican Air Force veteran, fairly conservative in a lot of ways, but someone who wasn't afraid to work with a Democrat from Massachusetts. He had political courage, and he was willing to, put his reputation on the line to just get this done. And I knew I could trust him at the end of the day. That's really important. The second thing I'd say is that never lose sight of the mission, right? For all the political battles, I think Chris and I were good at staying true to the mission and not letting these various detractors, steer us away from what we were trying to accomplish. And then the third point I'd make is that, and this is especially important in politics, but I think it can apply in the business world as well, a lot of the negotiations that we had to work our way through to get this passed just were better happening out of the public eye. And so sometimes it's tempting when you're frustrated with someone who's just being really ridiculous and opposing what you're trying to do, to just let's go tell the public about this and call them out on how ridiculous they're being. But actually, sometimes that makes people dig in, and it can make a political problem grow. And so sometimes it's better to just get everybody in the room together and try to hammer it out, as opposed to making a big public scene. So just a few things off the top of my head, but at the end of the day, this was a long effort. I mean, it took us over a year of fighting and fighting and fighting to finally get this through.
Well, a lot of times we have these discussions with guests, and I've got to summarize all these different aspects into 3 takeaways for leaders that are listening. And you just did it in just 3 succinct ways. One is, find a reliable and partner, and courageous was another word you used, to work with when you're trying to implement change. The other is never losing sight of the mission. People can be arguing over nuances. What digits do we use? But if you stay focused on the mission rather than those little issues, right, then things tend to move along, maybe not at the pace you'd like. And the third piece is when you are having some of this contentious discussion, right, have those in private. People are more apt to kind of let their guard down and feel less attacked, it seems like.
That's right. And I'll add a fourth just for icing on the cake here, which takes me back to my Marine Corps leadership training, which is go with the 80% solution. You're not going to have perfect information. If you wait to get 100% of the data that you want, the decision may be too late. And this mattered a lot, not just in passing the bill, but in implementing it. There were a lot of people who called on us to delay implementation because they weren't quite sure that everything was perfectly ready yet. And so after we had passed the law, we just were coming up on this deadline when 988 would go live. And we had to really fight to say, no, it might not be perfect, but every day that you're waiting, someone's not getting help. So just go get it out there. I mean, of course, we did a lot of work leading up to this point to get as much ready as we possibly, as many of the services, the volunteers, the state coordination, all this stuff ready as we possibly could. But at the end of the day, you got to be not afraid to make a decision to go.
Yeah, the saying in Silicon, the saying in the Silicon Valley in the tech world is done is better than perfect.
That's right.
Yeah,
that's right, and that's often the case.
Yeah. Well, I know you're in between votes or finishing votes, so I appreciate the time that you were able to provide and contribute and the voices and wisdom that other leaders can learn from this. So thank you for the time today.
Phil, thanks for having me on.